Wow. People have trust and faith that this is the place where we go, you will be treated, the best of the things will be available. There is no question about over-investigating or over-treating. Generally, we don't put the people on duties beyond 24 hours.
Even that to me is a lot, 24 hours at a stretch.
We were just doing the patient care services. We never look into what is the requirement of the doctor and the nurses in the hospital. If India has to get a Nobel Prize in medicine or physiology, and probably it is going to be from All India Medical Sciences, New Delhi.
The All India Institute of Medical Sciences in New Delhi. That's a name synonymous with the best medical care in India. Every day, some 18,000 patients knock on its door. Spread over an area of more than 200 acres, the main hospital of AIIMS boasts a faculty of more than 800 doctors and 90,000 staff. And heading this massive medical machinery is its director, Dr. M. Srinivas. In 2 years at the helm, Dr. Srinivas has been on a mission to ensure that the institute is corruption-free. His other goals are to improve the patient experience and, more importantly, to boost cutting-edge research. Dr. Srinivas, who specializes in pediatric surgery, is with us today to talk about his vision for AIIMS and about his views on how to improve the quality of medical care in India. Dr. Srinivas, welcome to PTI's show at 4 Parliament Street. I'll start off by asking you about AIIMS. You've been the director for now 2 years. It will be coming up to 2 years on September 23rd. When the word AIIMS comes up, you think of excellence in the medical field. It is like the best name possible in India in terms of medical services. But at the same time, it also conjures up this image of overcrowding, thousands and thousands of people coming from all over India, coming to AIIMS. Along with them, they have their relatives, attendants. So there is this enormous rush of people at AIIMS. How is the institute able to cope with it? And even though we have set up several other AIIMS now in India, the rush in Delhi continues. It has not abated at all. What is the reason for that? Why are people still coming here? And what is AIIMS doing to elevate that?
See, the problem is that we started way back in 1956 by an Act of Parliament, and we are continue to be National Institutional Ranking Framework #1. The people come to us because of various reasons. One, the infrastructure. You name it, it is there. Second is equipment. You name the most sophisticated equipment in the world, probably every one of them, each one of them is with us. Then the people, the expertise. You name the surgeon, you name the physician of that particular super specialty, we are there. The biggest advantage of coming to All India Medical Sciences, not only for the public, also for us as a medical professional in this country, is getting all of them in under one roof. This is something which is very difficult in our country to get. So this is what the people look into that, and of course the cost of also, because most of our general patients are free unless it is implant or something like that. And then the cutting edge research, anything new which comes to the country, whether it is with respect to the equipment, particular drug, intervention, trials, all that come to that. So people have trust and faith that this is the place where we go, you will be treated, the best of the things will be available. There is no question about over-investigating or over-treating. And at least the people who can't go through the crowd, So this basically is the trust and the faith they have in the institution and the people. And they know that it comes. And it comes at no cost, Hardly they pay for the food, that's all, in the general ward.
But there are other AIIMS in other parts of the country also. So are they also witnessing the similar kind of situation, or is it peculiar only to Delhi?
The first 6 AIIMS which are doing wonderful, the first 6 which started, they are doing extremely good. They have reached almost to the level of the AIIMS-Delhi. The issue is that there is always a supply and demand mismatch. The idea of the other institutions, AIIMS in this country, was that they will come to the level of the New Delhi AIIMS. They will take care of the specialty and super specialty, which has not happened with most of the centers, but it will take time. Because you have to understand that, today we are whatever we are because of the 6 and 7 decades of our good work and getting that tag of Institute of National Importance, Center of Excellence, International. It takes time. So the first 6 7 are doing very well, but there is a large load, see, for a country like us with a huge population. The specialities and super specialty courses and the services are not available in most of the government institutions. There may be one government institution in one state, not to the extent of say AIIMS or the new AIIMS, but that will be very, very, less for the country which we have, especially for the complex and complicated cases. See, our forte is what? We always tell the people, please come to AIIMS if you have a complex disease, complicated disease, or a failed, procedure, treatment, surgery, or when the doctor in particular state or a capital city or a medical college says that, this is beyond my expertise and domain, I don't have this particular equipment, expertise, multidisciplinary, this surgery or this intervention needs this particular person, this particular super specialty, all of them, 2-3 people have to sit together, discuss, and then design the protocols and the surgery and everything. That is possible in institutions like All India Medical Sciences only. Very few people outside the domain of the AIIMS will be in a position to offer that kind of multidisciplinary approach. So that's the thing. Unfortunately, the crowd, again, it comes to that. The people come with issues which are very mundane. That can be handled, but at a state government medical college, or ordinary district hospital or something. That adds up to the problem for us, because the numbers means, the more the numbers, after a limit, the quantity will cut the quality at the end. That's where, sometimes we do feel that. And then we can't do pick and choose also. To a certain extent, we give preference to the people who have complex disease, and referred cases we give. But complex and complicated cases, difficult cases, say malignancy, which is growing very fast, definitely preference is given at All India Medical Sciences.
So Dr. Srinivas, AIIMS-Delhi has a vast legacy. Invariably, people do come to the institute for a second opinion or as a last resort. So therefore, could you tell our viewers something about the accountability of the faculty and the doctors, and more importantly, the steps to fight corruption?
My teacher was saying that, "Ek anar sau bimar." He used to tell that, so many people are waiting for the same thing. When there is a demand and supply mismatch, definitely there will be some issues. The crowd is again the problem. The crowd always leads to confusion and chaos. That's what is the problem with most of the government institutions in our country. And then once the crowd and the confusion, the chaos is there, the corruption also breeds in, because some agents will, go around in the institution. This happens in most of the government institutions in our country. And that we have contained it in a larger extent. We have put the systems and process in place. And today, if you walk into the All India Medical Sciences, for the past 2 years, we have been working hard to get the things put in place. Systems and process, put the transparency with respect to the administration. See, we were, one of the first orders which I gave the moment I joined was making the entire administration into the e-office, 100% digital, You will not find any paper in my office. So similarly, we are going to be totally digital from the hospital side. And then with respect to the procurement and recruitment, today we can say that we have put systems in process in such a way that everything is transparent. Because the moment, see, for example, if you go to if you can log into the All India Medical Sciences now into the emergency ward, it gives you, probably it is the only hospital in our country, and I don't know, where it will tell you how many patients are waiting outside the casualty right now in a dynamic fashion. How many are in the yellow area, how many are in the green zone, how many are in the ventilator red zone area. You can see it. To that extent, the transparency we are bringing it.
And digital hospital, is there a timeline by when you hope to achieve this?
See, at the moment, we are digitally 100% in the administration side. The hospital side, we are doing in silos. Each department is doing. We are on the national NIC portal. E-hospital is there in place. There are basic softwares available. We want to go beyond, so that it becomes totally digital. With Ayushman Bharat Digital Mission, we are in that. At the moment, we get our ABBA ID done. For example, I think we have done almost 7 lakh ABBA IDs created, and we got the #1 prize for the country in the ABDM mission. So similarly, this scan and share, again, ABDM, this thing where the patient can get registered and then take the appointment online. Again, we have the highest number in the country, and we got the award for that from the National Health Authority for these ABBA ID creations and the scan and share method. And then one advantage of ABDM and the scan and share is that you get the electronic health records. The biggest thing is that today, as we move, the record should move, and that is possible today. The National Health Authority through the Ayushman Bharat Digital Mission, we are in a position to have that EMRs seamlessly transferred as the patient moves from place to place without any hassles, of course with the consent of the patient.
In the entire medical industry, not just in AIIMS, I would think that the corruption stems from the discretionary powers that people in power have. What have you done to mitigate that?
We have cut down, see, as an institute head, the people always used to quote me when I joined that, it can happen, it used to happen, there's a precedence. Power is a poison, and the discretionary powers are lethal poisons, we should never have them, They are not good for us. And it's very important that we put the systems and process in place and put the transparency as much as possible. Especially if you look into that kind of transparency which we brought in our procurement process, you can never get any kind of scams and scandals in AIIMS, in All India Institute of Medical Sciences, New Delhi. That I can guarantee you. Because on one side we have e-office, which is totally digital, and then the payment systems have come to the Sahas portal, which we have created in our own, with the help of the people, the agencies in the country. No matter how intelligent the person is, no matter how powerful the person is, no matter what kind of nexus they make, it will be impossible for the people to do any scams and corruptions in the system which we have created in AIIMS-Delhi.
Dr. Srinivas, what do you think of Ayushman Bharat health insurance scheme? Has it lived up to expectations, and what can be done to further improve the acceptance and implementation?
Not that I'm a doctor, I'm speaking, but as a citizen of this country, I think the most powerful, most successful program which I can think of, that it has helped the people to remain at that level rather than going down into the poverty, the out-of-pocket expenditure which used to happen. Today, that millions of people have got that advantage of that. We are also very proactive, and I think we have almost had 30,000 patients so far treated under ABDM mission, which is good for the patient because they come to All India Institute of Medical Sciences and get the quality care without spending from their pocket. The digital mission has done wonders, and today, as I said, that whether it is creation of ABA ID, whether it is the usefulness of the scan and share for the appointments, and seamlessly transferring the electronic health records in the portal, that is something which has made it possible for us. Probably, we are far better in some of the countries in the world where the digital mission has taken to this level and help the people. That's the most important thing. Is today the poor man doesn't feel that he doesn't have to sell the properties to get the treatment, He gets that card and then he says that he has the right for the treatment at the best of the institutions, not only in the government institutions but also in the private institutions of the country, and whichever is near to his house.
Sir, we understand that doctors have a punishing schedule which goes up to 24 and at times even 36 and even 36 hours at a stretch.
And beyond. And 40, 42.
So why is that so, and doesn't this long working hours impact a doctor's performance and the doctor-patient relationship?
Sometimes because of the necessity of the patient's load, if my patient is not doing well, if I have operated on him, and if I have to stay back and then see the progress of the disease, and see the patient in a better condition for some time, I may be staying back. But definitely we don't want the thing. There are regulations in many parts of the world where we are not supposed to work beyond X number of hours in a one stretch or in a week. Well, definitely, if you ask me personally, yes, there should be restricted number of working hours, whether it is in one stretch or per week, and post-duty offs or something. We are conscious about it, but sometimes, as you said, it depends upon the load of the number of the patients and the condition of the patients. We may be, extending on certain occasions sometimes, but definitely we will look into that. The All India Institute of Medical Sciences has taken the measures for that. We have calculated, what is our load and what all the things we need. Generally, we don't put the people on duties beyond 24 hours. And then there are caps on the total number of working hours in a week. Depends on I'm not saying the exact number because it depends from department to department. Some departments it may be very critical in nature, and then the surgery is prolonged for hours together. One surgery will take some 4 to 6 hours or 12 hours sometimes. So that may end up in that. Otherwise, as a general dictum, we want the people to not to do more than 24 hours in a stretch. We definitely encourage, and then we give instructions to all the departments that there should be post-duty off. Our time it was worse than this, as a student. But we don't want, because See, our children will not do what we have done, that endurance, So it doesn't hold good. We can't quote that, when I was a resident doctor, I used to work for 72 hours in a stretch. We can't say that now. We're conscious about it. Yes, as far as the quality and the quantity, yes, definitely, if the number of working hours are extending beyond a limit, definitely it will have some impact on the quality outcomes also.
You're saying 24 hours is the limit that you want to impose. Even that to me is a lot, 24 hours at a stretch.
See, the critical areas is 6 or 8 or 12 hours. The duty hours, when I go on a duty for that particular day in the department, say in pediatric surgery, I generally go at say 8 o'clock or 9 o'clock in the morning, and I take off at again 8 or 9 o'clock in the next day. So for the entire day, for the sake of continuity, I know that the patient has come on this day, and this belongs to my unit, my consultant, my name is there, and we know that how to manage for that day. And then the patient belongs to that particular consultant and the unit.
So this, the question of punishing schedule of junior doctors, that the spotlight was shown on it after the incident in the hospital in Kolkata. Also at the same time, there were other issues that also came to the fore after that incident, including the issue of safety of doctors. So as a member of the National Task Force, what would you like to say about how we can improve the safety environment for young doctors?
See, the outcome of that is that we have opened up our eyes, definitely, no doubt about it. There are issues, because it varies from institution to institution. If you look into the institutes of national importance like AIIMS and PJ Chandigarh, we are better off with respect to the infrastructure. That means, our duty rooms are there, they are well equipped, they have all the basic necessities, amenities. And then with respect to the hostels, we have that kind of facility in most of the bigger institutions. The working hours are defined. There's a pleasure of working also. The student also carries forward that, even if you say that, go home, he'll say that my patient I have operated, I need to be there. There's a pleasure of learning also in that. We need to look into all the things, whether it is infrastructure, we need to enhance our infrastructure, we need to make the standards and protocols, who are the people who are, by definition, the resident doctor means he has to be staying within the campus. That has to be made mandatory. That's what we are looking at that. Most of the institutions have but what has happened is over a period of time, some of the hospitals have expanded on the hospital side, but we have not expanded on the hostel side. So there has been a mismatch in the last 5-10 years in some institutions, bigger institutions also. So that needs to be taken care of. Then comes the duty hours and all. We are conscious about it. I think the National Medical Commission has recently come out with the guidelines, how many hours you can work, how much it should be in a stretch. That is going to be implemented, that is going to be implemented, and most of the institutions, including AIIMS, already we are almost implemented that. We are on the same page as what the NMC has recommended. With respect to welfare measures, definitely much needs to be done. Making them comfortable at the place, accessibility to the food and everything 24/7, and then the intra-institutional campus navigation, when the lights are not there, middle of the night, you have to walk from library to the hostel, what kind of transport you are going to give it to them, what kind of security exists. We need to be multi-pronged attack. Infrastructure, we have to have a lot of optimal utilization and resources needs to be put. With respect to the welfare, especially the working hours and what we have been talking about, that needs to be looked into that. The environment, the ecosystem has to be made to them so that they are comfortable. That's what we have not given much importance, I think so, because we were just doing the patient care services. We never look into what is the requirement of the doctor and the nurses in the hospital. So that is something which we need to focus. I think we are going to focus. We had thought about it. I think we need to do something more on this particular aspect. How do you make them comfortable at hospital and on the way to their hostels and the residential campuses? This is something needs to be looked into.
With more focus on female doctors and nurses who are more vulnerable to...
Yes, absolutely. Especially, see, the problem with the doctors and the nurses and all the healthcare professionals in the hospital is that we have 6 hours and 8 hour shifts, We may be ending up at, say, middle of the night, the 10 o'clock in the night and coming early in the morning to the shift duties. That's where the problems can happen if they are traveling from, say, hostel to the hospital area.
Several doctors' bodies have been demanding that hospitals should be declared as safe zones. Even IMA has demanded that. So being the head of a premier institute like AIIMS, How feasible is it to ensure a foolproof, safe work environment for medical professionals?
See, we need to look into that. Whatever the people who went on a strike, you look into those points, they're all genuine. If you look into that, somebody wants a duty room, safe place area, it should not be going through the dark areas, working hours has to be restricted, post-duty off has to be there, the mess facility should be available. People, many people should not be pouncing on them at the casualty area, emergency area. People, when they are doing night duties, extended duties and all, under the stress of the load and all, people should not come and question and then thrash them. Those are all the genuine things, what the doctors are asking. But what we create the ecosystem is, it depends upon each individual hospital. The big hospitals, it may be a little difficult, but we need to still do it. Smaller hospitals in the government hospital, even today, if you look into that, look into the AIIMS or bigger institutions, most of the systems are in place. Most of the systems are in place with respect to the welfare measures, with respect to the ecosystem, with respect to safety and all. So we need to have a fine balance, what people say that, whether you want to make it an airport with a fortress or where you want the patient to come to you and speak to you freely without much of the hindrances. When the things go wrong, when the patient deteriorates or patient dies or something is happening wrong to the patient, and suddenly not only one patient attender, many patient attender will pounce on that. That is a problem, and that's an area where we need to keep some sort of buffer, somebody at the level where a senior person or a medical social worker or somebody will speak to the patient attender and tell them, eventually, doctors are not God. There will be complications, there will be deaths, but there should not be negligence, as long as we follow the guidelines, SOPs, protocols, and if we do our whatever supposed to be done, there should not be problems. And if the problems happen, the patients and patient attender also has to understand that, what is the course of, normal course of that particular disease and the prognosis.
Do you think that the medical education in this country needs reforms?
Yes, as we evolve, definitely it needs reforms. That is for the job of the National Medical Commission, which looks into the medical education in the country. But we have an advantage at AIIMS New Delhi because we are not under the purview of the NMC, but we can do our own little bit of changes and the newer experiments in the teaching learning methods. Definitely we were looking at all those things, and we need to look into that in the sense what is happening now. The more and more the students are not attending classes, they are going more into the internet. Google Mataji will teach them more than the teachers. So that has become a big challenge for us. The second thing is that the focus is on going on to the postgraduate courses and all that. That means, you give less importance to learn bedside, because we as a student, learn more from the patient at the ward, at the casualty, at the operation theatre, besides the patient, from our seniors and from teachers. But now the focus from the beginning is that, get into the PG seat. How do you crack the PG examination, super specialty examination? Then these courses have come up, these tutorials and the various agencies have come out that, they go through, That has become a big challenge for us, that we want them to attend as much as possible the classes, that we need to work on that. We want them to go more into the hospital side and learn, stay besides the patient, because learning from the patient is not just the knowledge, it's also an interaction. How do you speak to them? How you are sympathetic? How much you are empathetic to that? How are you understanding? How are you looking at the patient as a family? It's not just the disease treatment. What are his problems? How is he getting to integrate with the family and the society? A lot of learning is there. We at that generation, had that advantage of doing that kind of teaching and learning and training in the medical institutions. Unfortunately, now there's a little shift on the postgraduate courses by the students. So that's a big challenge. We need to look into that and make them more and more into the bedside and learn more and more from the patient rather than from the textbooks. The other thing is the skills. Our time, we did not have much of those technology, newer equipment, gadgets, and then we need to learn them. And if we have to learn them, we can't learn and we can't experiment on human beings first. So now we have all these skills, education, technology, set facility we have at AIIMS. So that kind of facilities have come up now. Today we can learn, whether it is laparoscopy, whether it is the robotic surgery in a laboratory setting, first as a dry lab, then on animals as a wet lab, then on tissues as on a wet lab. Then we can go on to the human beings and do that. That's again a different task and different challenge for us in the teaching and learning methods. And every medical institution cannot afford to have that kind of equipment and gadgets and facilities because it is expensive. But we have, at All Indians Medical Sciences, we have set facility. We have even robots which are teaching the students, undergraduate, postgraduates, and super specialty resident doctors in a dry lab and a wet lab, so that they have the pleasure of doing for the first time. When you do it for the first time on human beings, the stress levels will be very high. We went through that kind of education. But no more that is there now. Now we have labs which will get you adapted to the things, All those things are available, robotics and other things. Set facility is there, technology is there to learn in an environment ecosystem where there is no stress, where you can learn from peers, take your own time, learn as you are whenever you're free from the hospital timings, rather than the pressure of, catering to the patient and learning and also doing the surgery and then the training in the hospital setting.
I have a follow-up question on the reforms. We see that a lot of Indians go abroad to study medicine, places like China or Ukraine. Is that a good thing because we are not able to provide enough seats here, or because it's easier to just pay and get into a medical college there?
This problem, I think last 10 or 20 years, this has become a big problem. Well, if you look into the statistics now, so what we were 10 years back and today we have almost added up 100% more, it is doubled with the number of MBBS seats in the country. So that is being partly taken care. As far as going abroad, well, few institutions are good abroad also, but most of the institutions abroad are not up to the mark, because what we have heard and seen the students who come from there, they don't have this kind of teaching learning environment, They don't have this kind of huge hospitals where they are taught bedside in an English language. And then how do we interact with the patients? Is a lot of learning, a lot of learning in undergraduate level and postgraduate level. How do you actually speak to the patient? How do you elicit the history? How do you make your provisional diagnosis? How do you make a diagnosis based on what questions and answers we take with the patient and the patient attender? That kind of thing is not possible when you go abroad, where the number of patients are less, number one. Second, the medium of instruction may be different from the English. And then when they come back to India, again they have to integrate with our system. They have to understand our patients, how do they work with the things. And it's not just the investigations which give the diagnosis. Today, unfortunately, we have become more and more into the investigations, because everything, the doctor asks for X-ray, ultrasound, CT scan, MRI, PET scan, and then take the diagnosis. No, we were taught in a different way. We were taught in how do you look into the patient, what is the history you take, based on that, how do you make a provisional diagnosis of first 5, the common diagnosis, and then go for the investigations. That kind of training and teaching may not happen in most of the centers abroad, especially the countries which you are speaking about. But there are good institutions abroad, there's no doubt about it, but very few of them.
Dr. Srinivas, how big is the role of artificial intelligence today in your diagnosis, procedures, surgery, and medicine? I'd like to know your views on this.
Just to add to that question, you talked about bedside diagnosis, getting the history, because there's a lot of human involvement between a doctor and a patient to reach a diagnosis. Can artificial intelligence do that?
Yes. See, eventually AI will come to us. It has already come to us. Today, if you look into our own institution, AIIMS New Delhi, a lot of work is happening. Today we have AI in X-rays. We can know before the doctor, because doctor may be looking at 300 patients of X-rays in a particular duty day, resident doctor, and the AI will help us to that. Well, this is normal X-ray, this is a tuberculosis X-ray, or this is a patient with a cancer. The triaging is possible. Suppose if somebody needs an immediate intervention, we know that, we get an alert that, this patient needs an immediate intervention. We look into that. A patient goes into the CT scan gantry, and then the AI is assessing that whether there's a bleed in the brain or not. And if there's a bleed in the brain, normally, it would have taken some time for us to look into that particular report and tell the doctor. And today the technology exists that, the moment the patient comes out, it gives an alert to the doctor that this patient has a bleed, probably needs a surgery. Immediately you need to look into that. That kind of facility is possible with AI. And looking into the numbers, again, our problem with our country is what is the numbers. See, what a doctor in the Western country will see, say, 20 cases in a day. We will be seeing almost 100 to 200 cases in a day. So we need to look into that. The AI will help us that, which is normal, which is abnormal, which needs an immediate intervention. AI is going to be very useful for us, especially for our numbers, our Indian context, especially for triaging, early diagnosis, and enhancing the quality of the treatment. Today we know that, the diagnosis which is given by the AI, we can do a second opinion and then see that, well, which is true or not true. And a lot of research is happening. Most of the departments in our institution are working on AI projects.
Sir, with the increase in the lifestyle-related diseases, what are the kind of challenges that you see are in front of us, and what is the way forward in this regard?
This has become a huge problem for us.
Like diabetes, you mean? Or?
Yes. See, we have conquered almost infectious diseases. No more you hear a person dying of cholera. Very rarely you will hear somebody dying of, say, typhoid fever and all. You look into 1950s, 60s, 70s. People would have died of appendicitis, cholera, typhoid. Malaria. So we have overcome all those things. We at least control them to a larger extent. Deaths don't happen that many numbers, now. But the lifestyles are killing us now. We are becoming number one in most of the diseases. You name it, whether it is diabetes, hypertension, obesity, cancer, they are increasing in numbers for two reasons. One, it's the lifestyle diseases. Second, our number of population is increasing. Third is our longevity. Age is also lifespan is increasing. The more we live, the more we have chances of getting a cancer and this thing. And lifestyle is definitely adding up to our problems. This is something which we need to look into that. A lot of health education has to go. All this goes back to again primary prevention. We have to go to the citizens, go to the masses and tell them what is good and what is bad, what is the right diet, what is not the right diet, what is the wrong diet, what is the right way of living, lifestyles, which is right and wrong. We need to look into that and tell the people, because that has a huge impact on us. The kind of money which we can save, the kind of economic growth which we can have if we put focus on the lifestyle disorders, especially for our country.
हमारे पास ट्रेडिशनल मेडिसिन सिस्टम्स हैं, जैसे योगा है, सिद्धा है, आयुर्वेद है. क्या इनको मॉडर्न मेडिसिन सिस्टम के साथ इंटीग्रेट करके डिजीज़ मैनेजमेंट में कोई हेल्प मिल सकती है?
करना चाहिए. बहुत अच्छी चीज़ है. वेरी गुड क्वेश्चन. आपने हिंदी में पूछा, मैं भी हिंदी में आंसर करूँगा. देखो, हम कभी भी ये नहीं सोचना चाहिए कि द सो कॉल्ड मॉडर्न मेडिसिन और हमारा ट्रेडिशनल मेडिसिन ये कॉम्पिटिशन है. कॉम्पिटिटिव कभी नहीं थे, होना भी नहीं चाहिए. ये कॉम्प्लीमेंट्री है. जो चीज़ हम आयुर्वेदा में हमें पता है, प्रूवन है, इफेक्टिव है, वो एजेस से है, हंड्रेड्स ऑफ ईयर्स ऑफ ट्रेडिशन है, वो उसको प्रूवन है, इफेक्टिव है, वैल्यू है उसका. अगर हम उसको हमारे मेडिसिन में इंटीग्रेट कर सकते हैं, उसको सप्लीमेंट कर सकते हैं, उसको कॉम्प्लीमेंट कर सकते हैं, उसमें बेनिफिट मिल सकता है, तो करना भी चाहिए, कर भी रहे हैं हम. ऑल इंडिया इंस्टीट्यूट मेडिकल साइंसेज में अभी हमारे पास CMR है, एक ऐसा यूनिट है, और उस यूनिट में हम सारे जो भी है, डायबिटीज़ है, हाइपरटेंशन है, माइग्रेन है, ब्रेन का कुछ डिसीज़ेस हैं, उन सब में हमने इंटीग्रेट किया है. वहाँ पर हमारे डॉक्टर पेशेंट्स को दवाई भी देते हैं और ये भी बोलते हैं कि ये आयुर्वेदा है, ये योगा है, ये मेडिटेशन है, इसका भी आप करिए. उसके लिए वहाँ पर है, यूनिट्स भी है, सिस्टम भी है, प्लेस भी है, और वहाँ पर उनको बिठा के समझाया जाता है, बताया जाता है, करवाए जाते थे, और क्लिनिकल ट्रायल्स भी किया है हमारे पास एम्स में. और उसमें ये भी बताया गया कि जब आप मॉडर्न मेडिसिन के साथ आयुर्वेदा, योगा, मेडिटेशन इन्वॉल्व करते हैं, उससे काफ़ी बेनिफिट्स भी हैं, और अच्छे अच्छे जर्नल्स में भी पब्लिकेशन हुआ है.
You have a very ambitious master plan for developing AIIMS in the coming years, to rejuvenate it, to expand it. Where are you now in this plan? What have you achieved so far?
See, problem for the AIIMS is we can't vertically grow because we are in the air funnel. Though it's not that it's Safdarjung Airport, we are in the flight path air funnel, and we can't go horizontally because we reach the saturation. So the only way, and we are 1956, most of the buildings are old now. So eventually we are going to have the new master plan. Right now we are expanding on a new OPD. If you go to the OPD today, most of our specialties have moved to the new building. It's a beautiful building, you must have seen it. Similarly, for the super specialties, cardiac and neuro and ophthalmology and oncology, we are coming out with a new OPD building that is called super specialty OPD besides the present OPD. So that project is going through. The second block which we are going to get is the critical care and infectious disease block. which is coming up in our JPN, the trauma center area. The third thing what we are looking at is that how we are going to expand our services at the National Cancer Institute, Jajja. So we are going to get National Institute of Child Health there. So a lot of new buildings are going to come. I think recently, you must be aware of that. Recently we got the mother and child block, which enhanced our bed strength by 20% of the institution. We got the surgery block, the new surgery block. We got the National Center for Aging, the building which is on the other side of the surgery block again. Again, we have added up this thing. So with those buildings, we increased our capacity of the beds to the 20 to 30% of our total capacity. Today, we are almost 3,600 beds, one of the largest hospital of the world. And gradually, we are going to have, the master plan envisages that on the eastern part of the campus, it is going to be the entirely hospitals. The present buildings, 1+2 houses, quarters which we have, they are going to be demolished, and then we are going to build the entire clinical facilities on this side, clinical and research and academic facilities on the eastern part of the campus. On the western campus, the residential accommodation, the tall towers will come up.
Dr. Srinivas, despite various initiatives and reforms, there's a huge difference between India and Western healthcare system. So by when we should expect that to have similar facilities, if not better?
Well, as far as the quality is concerned, I don't think we are below the standards of international standards, especially in the institutions like institutes of national importance, AIIMS, PGI Chandigarh, JIPMER Pondicherry and other things. Of course, we have private players also in our country. I don't think there is any equipment or technology which is abroad which will bring a change in the particular that particular protocol will bring a change in the disease condition or survival rates, which is not available in the country today. I think we are on par with most of the best centers of the world, especially in the bigger institutions in our country. There's no question about that we are falling short in any of the respects. You name the technology, you name the equipment, you name the gadget, you name the surgical skills or whatever the protocols we have in the best centers of the world, we have in most the best centers of the country also. So there we are at the level. We may not be at the level of the primary and secondary care level, but it's a different issues. We have different problems in our primary and secondary, and those developing countries have different issues of the primary and secondary. So we can't compare those things.
Dr. Srinivas, the ordinary person in India is caught in this dilemma. One, you want good quality medical care, so you go to a private hospital thinking you'll get good quality. But there you are very suspicious because you don't know whether the doctor is over-prescribing all the tests, and you have this at the back of your mind, this impression that the hospital is going to squeeze you as much as possible, extract the most money out of you by giving you, forcing you to stay in the hospital or not. So you would rather go to a government hospital where you can be assured of quality diagnosis and quality care. But the quality of maybe the nursing care or just the atmosphere in a government hospital is not conducive for an ordinary person. So that person is caught in a dilemma. How do we resolve this? How do we make government hospitals as good as private hospitals in terms of infrastructure?
Let us not talk about private hospitals because it's better, so I should not be commenting on them. But generally I'll speak as a doctor. We should not be overstretching too much on the private people, saying that they are the people always squeezing the things. There are issues there also. You look into from their point of view. We are thoroughbred. All along I've been through the government institutions, whether I've studied, trained and working. I never stepped into a private institution for teaching, learning or services. There are issues in the sense, when you are practicing in a private thing, you have to be a little more overcautious. So there will be some amount of looking at the things. If we don't do particular thing, if the patient says that why you did not do, that may be an issue. The second thing is that the patient also asks for it. Today most of the patients are also learning from Google Mata and then saying, Doctor Sahab, PET scan nahi kar sakte kya? NMR nahi hoga, MRI nahi karenge kya? So if the patient asks that MRI is, in a government setup, I can say that, I am confident about my diagnosis. I don't need a particular MRI for your spine issue. I know that, you don't require. And I may say that even if I do an MRI, you may not need a surgical intervention. There's no point in getting investigation. That may be my thinking in a government setup. But in a private setup, the patient says that, are you not getting it MRI? What is my diagnosis? What is the localization area problem? How much is my disc which is bulging? So the doctor may be forced to get the thing, the so-called over-investigation point of view. So we need to look into fine balance, what is happening there. The doctors are also investigating to see that the so-called defensive treatment, you have to be on the defensive side always, that I have done all the investigations to see that all the conditions are taken care, so that in the event of he goes to somewhere and get into the issues of medical negligence because that particular doctor did not do particular investigation, that may be a component of that. When it comes to the government side, yes, we build hospitals, but I think we need to put hospitality also into the hospitals. I fully agree with that. There is some amount of welfare, the patient grievances, redressal system, ecosystem of that giving the hospitality which these people get in the corporate hospital. We are conscious about it. I request you to come to AIIMS and then see that what kind of measures which we are putting it. We already put some of them. We are putting some of them. We are trying to see that the patients sit in a lounge like an airport, an air-conditioned area where all the information is available, health education is made available. We are making them to go through the battery-operated vehicles. We are taking them through the areas where they will go by the appointment system so that the crowd doesn't produce chaos and confusion in that particular areas. We are looking at that kind of thing. Definitely, we at a government hospital, we need to look into a little bit of the so-called hospitality aspect so that we make them more comfortable. Comfort is something, we are always on the run to do more and more numbers. I think somewhere down the lane, if the numbers are very more, we don't have that kind of system which takes care of the small nitty-gritties of comfort, cleanliness, hospitality. We are focusing on them. I think from 6 months from now, we will definitely compete with the corporate hospitals of the Delhi and then say that, we are equally matching to those comforts which the patient is getting in outpatient or inpatient.
Including nursing care?
Yes.
So that's
yes.
really important, post-operative or...
Yes.
What about the quality? How accredited are your institutions and where do we place ourselves internationally?
See, All India Institute of Medical Sciences today is #1 with the NRF rankings. But truly speaking, we want to be #1 in all domains, whether it is the patient care services, whether it is the teaching learning, whether it is research and the administration, and now the good governance and transparency. The quality, we have been very conscious. Unfortunately, in the government setup, we sometimes think that, these accreditations are not important and all that. But AIIMS has taken the lead. We are the first in India amongst the AIIMS to go for the NABH accreditation and NABL lab accreditation so that we maintain our quality and standards. Because this is very important, because when we are judged in the platform compared to the corporate hospitals, somebody who is looking at the hospital, and if somebody is coming from abroad, suppose he wants a treatment in AIIMS or in India, he will look into that, what are the accredited hospitals in this country. So we get into the bandwagon of that list, this hospital is NABH accredited, NABL accredited lab. That means, our quality is assured because there are internal standards, there are audits, there are external standards, there are periodic evaluations and audits. So we maintain the quality and we are very conscious about the quality now.
So what is your vision for AIIMS in terms of putting India on the global map?
See, in the research we have definitely taken a lead, definitely. See, you have to understand that, if we don't do the research for the diseases which are important, which are very geographical specific to the nation, who else will do that, The particular disease and the issues which are very particular to our own institution, our own country, we need to look into that, and we do have a focus, whether it is through the Ministry of Health and Family Welfare, Indian Council of Medical Research and AIIMS, we all look into what are the problems which we have in our country and what are the research which we need to do on that, we do focus on that. In a research in a larger context, what we can say is that, if India has to get a Nobel Prize in medicine or physiology, and probably it is going to be from All India Medical Sciences, New Delhi. This is something which we need to look into that. On that vision, we are working on that, if at all we can do something research which has a social impact, look into the diseases and the issues which are specific to our country. The kind of focus which we give, you look into the people who do that kind of research abroad, they are too focused on a small area. And the AIIMS has a mandate for all the so-called Trinity mission, we have patient care to do, we have teaching learning to do, we have to do research also. So we are working on all the aspects. If you say that, if I give some committed time of my own, or you get only people who are very focused only on the research, pick up the research questions for that particular, our country, our geographical locations, what is that which will have a huge social impact. That definitely will be useful to that, Our time goes more for the patient care, less for research at All India Institute of Medical Sciences, New Delhi, because when we see a patient requires our care, when it needs an intervention, when the patient is dying in front of us, obviously we'll spend more time with the patient. That takes away the time, because if we have to get a Nobel Prize, that means, we have to be totally focused. See, it happens abroad, there are protected time. Somebody is into this particular thing for particular time, and another time, for say particular percentage of his time or particular period of the years, he's totally focused into he or she is focused into the research side only, so that they are able to do more.
Dr. Srinivas, thank you so much. This was really enlightening and educational and informative. Thank you so much for talking to us.
Thank you very much. Thank you, everybody.